Something else a lot of people should be interested in this morning, the American Psychiatric Association's revisions to its Manual of Mental Disorders. Big changes that are already causing some controversy. It is the first time in 19 years that the manual has been updated. According to the task force chair, our work has been aimed at more accurately defining mental disorders that have a real impact on people's lives. Yet there's been a lot of debate in the media about the changes. Asperger's out. Now it's part of the autism spectrum. Bereavement over the death of a spouse can be diagnosed as major depression. Hoarding and binge eating are in as newly defined disorders. Also new, severe temper tantrums in kids, now being diagnosed as disruptive mood dysregulation disorder. Today, contributor Gail Saltz is a psychiatrist and associate professor at New York Presbyterian Hospital. Psychiatrist Sally Satel is a lecturer at Yale University and author of the book Brainwashed. Ladies, good morning to both of you.
Good morning.
Why should we care about this?
It's the update, it's the newer version, but really, I don't believe this is going to change dramatically the way people are going to practice, because most clinicians understand you need to treat symptoms and not diagnoses.
But if a condition no longer exists, like Asperger's, it's now under a wider heading of the spectrum of autism, and you are someone whose child is receiving care for Asperger's in school, will they still get that care?
Oh, they'll still get that care. In fact, the American Academy of Child and Adolescent Psychiatry has a fact sheet that should calm parents down. Those children will be now called autism spectrum disorder, and they will get care.
Why so much?
They might actually get more funding because autism, schools give autism more services than they do for Asperger's.
So the book is not technically even out yet. It's about to come out, and yet also already it's the subject of controversy. Why?
We understand that actually we're going to need to move in the direction, in a research way, at looking at the brain as the source of what's going on. We need to look at the biology, we need to look at the genetics, and that will probably be the future of diagnosis. But this is the best that we have right now. So it's the conflict of people understanding that maybe it's not sufficient for the future, but it's the best that we have to work with.
I think the fuss is because psychiatry is a fraught discipline. People think this is a book that distinguishes normal from abnormal. There are bright lines. It's not the case at all. This has always been a framework, a loose framework for thinking about patients so doctors can talk about them with each other.
Real quickly, things like binge eating, any changes that are going to impact people in the diagnosis of binge eating?
Yes. Now, actually, there will be a diagnosis where if once a week for a number of months you overeat to a great extent and feel badly about it, you could receive this diagnosis. But the truth is, if you're just eating your pint of ice cream and you don't feel good about it, it's not causing a big problem, you're probably not going to come in for treatment for that.
And bereavement after the loss of a loved one, I'm experiencing enormous depression.
Same thing. If a person comes to a psychiatrist in the wake of a loss, it means they're suffering and they need help. It doesn't matter what we call it. Now we call it major depression disorder because before we called it bereavement.
Though it does concern me that some people, that's the one that concerns me the most, because some people might get medication from some doctors for something that really should be support and care and viewed as bereavement and not as major depression.
Yeah,
ladies.
True. That's always been a problem in psychiatry. Too quick to medicate. But if we didn't have 15-minute office visits, we'd have more time with people, and that's what's so important.
Doctors, thank you both very much.